The gentlewoman from Bedford, Ms. Byron.
Thank you, Mr. Speaker. Speaking to the bill.
Gentlewoman has the floor.
Thank you, Mr. Speaker. The bill before this House of Delegates is the key piece of the first major effort at significant reform to health care in a long time. Delegate O'Bannon's bill responsibly reforms our arcane Certificate of Public Need law to bring Virginia's health care system closer in line with the principles of the free market. The legislation takes a measured approach. It protects rural communities and key services. It establishes a reasonable transition timeline for the phase-out of COPN. And it includes strong charity care requirements to level the playing field once and for all. As Delegate O'Bannon said, this legislation will improve access, increase competition, and most importantly, lower costs for the patients. I hope the House will consider it for the reasons outlined by the gentleman from Henrico. Mr. Speaker, we need these reforms, and we need them now. As an illustration of the urgency of this situation, I'd like to read briefly from a letter sent to some patients of a local urology practice that was purchased by our region's healthcare monopoly. It starts out, "Dear valued patient," and I'll take out some of the names in here. This center is now an outpatient department of our hospital. Please know that your location of care has not changed. As an outpatient department, your care will be billed like other hospital services. You will now receive 2 bills, one from your provider for services and a second bill from the hospital for related services and care. What will this mean for you? You will likely need to meet your annual deductible prior to your insurance paying its portion of the payment. You may also be responsible for any amounts not paid by your insurance company if you don't have secondary insurance. Some patients, depending on their insurance, may pay more out of pocket for these services and procedures than they have in the past. We will do everything we can, though, to minimize this impact on you. Financial assistance is available to those who qualify. Well, Mr. Speaker, let me paraphrase what these patients were told and what you just heard. You're going to get to go to the same doctor. You will see that doctor in the same place. You'll have access to the same tests and services. The only difference is you're going to pay a lot more. There are 2 other facilities that have received similar notices that they have reclassified to an outpatient facility. This is what's taking place in healthcare under COPN. Hospitals with local monopoly protections are gaming the system at the expense, quite literally, of their patients, and we are allowing it to continue. Mr. Speaker, that's why the opposition to this bill is so strident. Last fall, the Virginia Hospital and Healthcare Association launched a positive ad campaign to promote the values in our communities. Their stated goal was dialogue. VHHA board member James Cole said, "We're here today to begin a dialogue to bring to the public's attention that there's a problem." But over the weekend, that dialogue took a nasty turn. The VHHA ran their own political attack ad going after those engaging in a public policy discussion over COPN. Their ad was baseless and misleading, containing all of the ingredients that have caused so many Americans to turn away from politics and policy debates. The message was simple. Hospitals are on the brink, they're on the financial precipice, and COPN will push them over the cliff, leading to hospitals closing and, as the ad said, putting lives at risk. Hospitals are obviously integral to each of our districts. They provide life-saving care, good-paying jobs, and they play a big role in our communities. President Obama's Affordable Care Act has made their challenges greater, stripping billions in funding. There are undoubtedly some hospitals in Virginia facing tough decisions as a result of that. But the assertion that hospitals are on the financial precipice and will close if their localized monopolies are not guaranteed in perpetuity is absurd. Mr. Speaker, I think the VHHA has been less than an honest broker. But I do agree with the VHHA on one account. We do need to have a dialogue. We need to have a frank and candid discussion about hospital finances in Virginia. Here are a few data points for you. According to data from the Virginia Health Information, the combined profit of Virginia's hospitals was $1.9 billion. That is $150 million higher than last year. The number of hospitals running deficits has fallen each year for the past 3 years. When added together and sorted by region, the hospital industry is profitable in every single region in the state. Of Virginia's nearly 24 affiliated groups of hospitals, only 2 hospital groups are running deficits. The net worth of Virginia's hospitals is over $16 billion. Mr. Speaker, those top-line statistics paint a clear picture to me. Yes, Virginia's hospitals face some challenges, largely due to decisions that are made in Washington and originally supported by the National Hospital Association. But no, they're not on the financial precipice. But no, there is another statistic that is also worth mentioning, but it needs some context. Virginia has a number of not-for-profit hospitals. These hospitals do not pay taxes in our communities, and they are protected by the monopolistic COPN laws on our books. But these hospitals do make a profit, Mr. Speaker, regardless of their tax status, and the leaders of these hospital systems prosper as well. The top executives at Virginia's not-for-profit hospitals earn over $42 million in annual compensation, according to the latest data that was filed with the IRS. Mr. Speaker, I'm a conservative. I don't fault anyone for working hard and getting paid what they earn, nor do I fault any business for making a profit. But the citizens of Virginia deserve an honest dialogue with the full set of facts before them. As we consider the legislation before us, I hope the members of this House will consider this information. The opposition will tell you that the situation is dire, the hospitals will close, we heard they're going to burn down, and the lives will be put at risk if we don't pass the bill. Their claims do not have a basis in fact. The truth is, yes, hospitals are facing tough economic times, like every other industry and business group that is out there. But with $1.9 billion in annual profits statewide and with over $42 million in executive compensation paid out annually at nonprofit hospitals, the facts are telling a different story. The legislation before you is a good bill, but there is much more work that needs to be done. Unfortunately, the hospitals have not come to the table in good faith. Passing this bill to the Senate, where we can continue to discuss how to improve it, make it better, is the only way that we're going to bring the stakeholders to the table with us. I would encourage the body to keep the bill moving forward. Thank you, Mr. Speaker.